Yes, I was asked to join a session where there were a number of talks looking at how designers of trials and those who conduct trials engage with patients both in the design of those trials, in the conduct of them, and in sharing the data that come out of the trials. And I think probably the key message that came out in the discussions was we don't pay enough heed to what patients have to say when we're designing trials and thinking about whether the interventions that we might come up with are actually acceptable to patients. Patients are often willing to join trials because they want access to new medicines and hopefully better medicines, but there's still improvements to be made there. The pieces that are not so good are the elements of designing the trials and engaging patients in doing that, and then sharing the results of the trials afterwards. So with respect to the design element, we've done some work with patient groups in the UK, CML patient groups, and internationally. We have an annual face-to-face meeting, but increasingly we've used web technology or text polling technologies to try and get opinions from an audience or from a group of patients as to whether some of our ideas are acceptable or not. And we did a bit of an experiment today in the meeting with some voting just for some fun. And even that simple experiment, asking about whether two different interventions with slightly different risk and benefit profiles would be acceptable, split the audience. So knowing that when you come to design a trial, rather than basing it on your own presumptions, is very important and helpful information. And then when it comes to sharing, I think we've been a bit slow, I think, in the research community to embrace social media, broadly speaking, or the available technologies that the web offers. So again, I think we need to up our game, share the information that we have coming out of trials, papers, reports, what have you, much more actively with patients, rather than just expecting them to have the trial done to them, rather than done with them.